Hello everyone, I am Dr. Shikha Garg. Today we are going to discuss skin allergies. Almost 30% of population of India are affected with the skin allergies, where there is an allergen, which could be anything, could be food, could be latex, soap, any detergent, or any air allergen. There are many endogenous things which we are taking, or there could be exogenous which we are using on the skin. So there could be lot many things which can act as an allergen to you. To know what kind of allergen is affecting you, you need to get tested to know that. But commonly used things can be very more common as an allergen, and they can cause skin allergies, which can lead into skin irritation, redness, itchiness, or there could be a serious conditions like eczema, hives, angioedema. All these things can occur. So we are going to discuss in detail what kind of skin allergies can happen, what kind of allergens can be there, and how does this allergen works. Basically, it increases your immunoglobulin IgE in the body. When IgE is increased or released, it indirectly releases histamine, which will cause all the symptoms like itching, redness, hotness, everything. So we are going to discuss how to know what kind of allergens can cause skin disease, how to get tested, about knowing what kind of things which you are commonly using, which might not be considered as an allergen per se, but might be bothering you. So we can get tested, how to know what kind of allergen is affecting you, what kind of skin disease it's happening, and how to get treated, all these things in detail in the upcoming PPT. We already have one molecular test, which is 300 allergen test, that shows allergic reactions in the body, that is the IgE, specific IgE, and also the total IgE to the 300 allergens, which include foods, spices, vegetables, your pet animals, farm animals, your respiratory allergens, all your home things, everything is included. All further details, I have put a link in the description box in the PPT, upcoming PPT. For further queries regarding the testing, or regarding any symptoms, or regarding any questions related to the allergies, feel free to contact me directly on the given numbers. Thank you. So we are discussing skin allergies, its types, symptoms, causes, and diagnosis. I have already made few PPTs regarding the allergies, how to get tested with the molecular allergen test we are doing in our lab. So kindly go through all the links which are being uploaded here. So this is the overview of the allergies. So it is the most common chronic disease. 30% of population in India suffer from some form of allergy. So it's an immune response to the substance, and it is usually harmless, what is called as allergy. And the substances which causes is called the allergens. So it could be animals like pet dogs, cats, food such as milk, gluten, pollens, bites of wasps and bees, pollution and dust, mites and molds, household chemicals and spray, and certain medications. Skin allergies are a reaction to an allergen or an irritant and can be caused by a variety of factors. So allergen is responsible for triggering an immune response. So what we are doing is, whenever there is an allergen in the body, there is a immunoglobulin which is released, which is called IgE, which responds to the allergen, but it then creates certain symptoms in the body. So these triggers can, what are the causes of the skin allergies? Triggers can be latex, pet tenders, laundry detergent, soap, chemicals, insects, anything. What are the type of skin allergy? The most common is in the form of eczema, which is also known as atopic dermatitis. It is more common in children, and the skin is dry, red, irritated, itchy, and there are other respiratory things related to it, for example asthma or allergic rhinitis or hay fever, and food allergies as well. Another one is hives or urticaria. These are the red bumps or welts that appear on the body. It is called acute urticaria if it lasts for no more than 6 weeks, and chronic urticaria if it is more than 6 weeks. So acute, it is most common due to exposure to the allergens or by an infection, and it is triggered by non-allergic things such as heat, exercise, medications, food items, peanuts, tree nut, shellfish, insect bites or infections. So it's a sudden acute thing. The chronic one are usually with the long-term things, so there can be many causes to it. Another one is the contact dermatitis. These are the reactions which appear when the skin is in contact with the irritant. More common are the symptoms are the rashes, blisters, itching and burning. So most common allergens are soap, laundry detergent, fabric softeners, shampoo, nickel in the form of jewelry, adhesives, nail polishes and latex gloves. So another one is the angioedema. It's a swelling in the deep layer of the skin and can occur in soft tissue such as eyelid, mouth, genitals. It is often together with the urticaria and it's an acute reaction. So it can last only for a few minutes to hours, but it's very more commonly allergic to the medication or food, and it is kind of an aggressive reaction to the allergen. Another one is a hereditary angioedema. It is a rare but very serious genetic condition in which there is swelling in the various parts of the body, which includes feet, hand, face, intestinal wall and airway. So what are the symptoms? A skin rash. Rash may have itching sensation, a raised bump, redness, or there could be swelling or scaling or flakiness of the skin or the cracked skin. What are the tips to prevent skin allergies? Minimize time in the direct sunlight, keep irritated skin protected with the moisturizer, avoid contact with the irritants if you know it. If you do not know it, go in for your testing so that you know what is the irritant, what is causing your skin allergy, and avoid scratching that rash or the hive area. So how is it diagnosed? So if you see any symptom of the skin allergy, speak to your direct doctor. It will consider your family history, your medical history, your symptoms, and any recommendation can be done. Initially we used to do skin prick test or the allergen test, but they are no longer really used because they are not specific. There are many blood tests which will measure your IgE levels. They are again good tests, but they are again not very specific tests, because IgE rays will show there is a certain allergen which is causing all those symptoms, but it will not let you know what is exactly the allergen. So now we have those molecular allergen 3NL panel LX blood test. It is highly specific and it tells about the specific and the total IgE in your body, and it tests almost every possible thing, which includes your food, your legumes, wheat, milk, your vegetables, spices, fruits, respiratory, all the pollens, respiratory things, all the food items, all the latex, all the farm animals, pet animals, danders, everything. So 300 is a huge panel, so you get to know exactly what is the allergen which is bothering you. So instead of getting the symptomatic treatment, you always get to know the allergen, so your best is to avoid it, and if it is unavoidable, we know how to go in for the treatment options. There could be immunotherapy, there could be other therapies which can help you with the treatment option if you are in a chronic condition. So this is the link of the allergy test I just discussed. You can go in for the details. You can always ask the question. Feel free to ask any questions you want. So all those kind of allergies in the children, in the adults, everything is covered in this. So for further details, contact me. Thank you so much.